Hello, everybody. My name is John. I'm a clinical educator with Draeger, and today I just want to talk to you a little bit about the V500 from Draeger. You may have heard in the news lately that a lot of news about ventilators and the need for ventilators and the need for different respiratory equipment, and we just wanted to take this opportunity to show you what we can do here. So one of the things that we've developed that has become very, very helpful, especially during the pandemic, is the ability to do multiple things with the same machine. So what we found with treating COVID-infected patients is that they need several different levels of respiratory care, and it starts with delivering high flow oxygen to non-invasive ventilation to invasive ventilation. And that's actually what we have all in one machine right here. So the very first thing I'll show you is the high flow oxygen therapy option. So by pressing just one button and using my ventilator circuit here, I can put a high flow nasal cannula onto the patient, and when I start the vent up, I have the ability to deliver flow and oxygen to the patient through this simple non-invasive device. If the patient condition requires it, we can actually just put the vent in standby. Put our circuit back together. And we can put a mask on this, and what this allows us to do is what we call non-invasive ventilation. So we have the ability to help somebody breathe with the use of a mask. And again, with just a couple of touches of a few buttons here, I can go ahead and start the ventilator up. And now I can do that mask style of ventilation. The third thing we're going to do is every once in a while we get a patient that needs to be helped in a much greater way, meaning we have to intubate them, or we have to put a tube into their throat to help them ventilate. We can do that as well. So again, with just the touch of a few buttons, I can now switch from one mode of therapy to another very seamlessly, very easily. This does a couple of things for us. It frees up real estate in the room. A lot of our ICU rooms are smaller. These three functions would normally be provided by three different machines. So imagine having three different machines in the room. And that's cumbersome. That takes up a lot of space in the room, especially if there's other devices that need to be put in the room. It also takes up a lot of the respiratory therapist's time and a lot of their energy to go and get a different device, bring it back to the room, put the patient on it, and then they have to take the old device out, they have to clean it. So this setup, the way that we've designed this machine is to maximize the ability of the therapist to stay at the bedside with the patient and actually minimize the number of machines that have to be used. So it's a cost savings for the hospital, it's an energy saver for the respiratory therapist, and it's a lot more convenient for the family and the patient in the bed, and that's really what we're looking to do.